Hi, everybody, and thank you so much for attending this evening. We're so excited to discuss sports medicine for female athletes and to acknowledge the specific needs of women in the athletic and healthcare realms. Many of you will know that on February 5th, we celebrated National Girls and Women in Sports Day, and we decided to use that event as a catalyst for awareness all month long. Today's webinar represents a culmination of that campaign, and we've assembled some of our wonderful and skilled internal experts to comment on different facets of physical therapy care for female athletes. I'm very pleased to announce our first speaker this evening, Caroline Jaycox. Caroline Jaycox is a sports physical therapist and the sports program manager for SSM Health Physical Therapy. She grew up in St. Charles, Missouri, and attended Maryville University to play soccer and study in their physical therapy program, earning her Doctor of Physical Therapy degree. She joined SSM Health Physical Therapy after graduation and completed her certification in spinal manual therapy. She became a board-certified sports clinical specialist to further fuel her passion in treating the athlete at all levels. Caroline enjoys running races and recently qualified for the Boston Marathon. She likes recreational soccer as well as strength training to keep up with her athletic population and her 3 young children. Caroline, we're so happy to have you here tonight. Thanks so much.
Thanks for the intro, Abby. I'm really excited to be here. It's an honor. This is something I hold near and dear to my heart, as many of us do on this call, and many of you that are attending, which is why you're here. I'm here to kind of kick off with an overview of kind of the role of PT in women's sports. There's many different facets that you're going to learn on this call of how we can really help elevate the care that women and young females can get within the sports realm. So I always like to start off with what is my favorite, kind of the traditional thoughts that people have of physical therapy. So a lot of times we get people that come in for maybe their first time and like, oh, I just thought you guys were like glorified massage therapists. This is really for older people learning how to walk or not fall, doing a lot of like hot, cold therapies, stretching and whatnot. What I really love is the reality of it. It is so much more. And in so many different ways, we're obviously here to talk more on the athletic population. There's so many different elements and roles that physical therapy alone plays in many different facets of our society. But I feel like these pictures are some of my favorites to kind of encompass. There's a lot that goes on. You're going to hear about the role of kind of pelvic health and the female athletes. It's more than just stretching. It's more than massage. It's taking these athletes from the start to the finish to get even back on the field, all the elements that go into that. And really, honestly, just building some awesome relationships. So I like to put a couple of the pictures of my patients had in the past. And it's just so fun to get to know these young women and really watch them grow as they build off and go into collegiate setting and so on, or just become amazing human beings. So there's, like I said, so many different elements and roles that we play within women's sports, let alone many sports. But this is just kind of a rundown of kind of the top points I feel like we hit. Injury prevention, I feel like, is one that more people are recognizing that we play a role in. Obviously, the sport specific rehab. Again, our goal in my setting, or hopefully in the athletic setting, is that we're really trying to make sure when an athlete comes in with an injury that we are setting them up for the best success returning on field. That means their rehab really needs to start replicating what they're doing in their sport. And if it's not, then that's something we need to address. Core and pelvic health, like I kind of alluded to just a minute ago. Performance enhancement, that's something people don't often associate physical therapy with. And I would say it's a little more of a niche thing as well. You do need a therapist that feels comfortable with that. But also a lot of times we will have resources, if we're not, to hopefully bridge that gap as well. One of my personal favorites is the different considerations, hormonal considerations. Obviously, we're dealing with young athletes, but as we span through our lives, like I'm a washed up soccer player turned runner. So there's a lot of different things that I'm now considering as I'm going through, childbearing years and then, gradually approaching perimenopausal and all those things. So there's a lot to consider there. And we take that into account when we're managing some of these athletes too across the lifespan. Really empowering through education. We spend lots of time with these athletes, with these patients, more than sometimes even they're spending with their family. So we really try to spend a lot of that time educating them, but also just helping them through life situations or ups and downs that they have through therapy. Most people know post-surgical rehab is a big piece of it. And then just cross-training functional movement patterns, things like that as well. I love this little schematic. I think it gives a quick glimpse, again, of the not simple elements that you have when you're dealing with an athlete. There's so much that goes into how an athlete performs on a month-to-month level, year-to-year, but also on a day-to-day, hour-by-hour level that we need to kind of consider as well. So there's the mental aspect, their training volume that ebbs and flows throughout the year, their general health, if they're a growing athlete, things are changing, bone quality and tissue, relative energy deficiency. So basically going into some of the nutritional side, which is huge. But also, again, making sure they're fueling enough. And then you get into the elements that go specifically to female with menstruation, contraception, what type they're using, general pelvic health, if they've had any trauma in the past, or they've had children or preparing to, or they're currently pregnant. And like I said, diet or nutrition as well, and how they're eating. These are unique opportunities I feel like that we have to really help. I don't have all the answers. I'm not here to say that I do. But I know I have a huge network of resources, including dietitians, sports psychologists, that I am happy to help connect them with, so that it's not like, sorry, I can't help you. Best of luck. We all know there's so many elements. We all know it on a personal level, whether you're dealing with an injury or not. So we really have an opportunity to dive a little deeper in some of these areas and then just help navigate as well. And kind of finally, what makes an athlete resilient? Again, most of us may be on this call. If you're not an athlete, you've, witnessed an athlete going through the transitions of life and training and building themselves or coming back from an injury. Athletes are really adaptable. They're typically very confident. A lot of them have developed this mindset that they know they can improve, they want to improve. How do I do it? Building effective coping strategies. Again, if an athlete's going to move to the next level, they really have to be able to deal with a really bad game or coming back from an injury, and just being patient with themselves. And that kind of goes with self-awareness, but then also having a strong support system. I typically like to remind my high school athletes or my youth athletes like that have nagging parents that honestly, my patients that do the best are the ones that have a parent or a friend or somebody who's like, did you do your exercises today? Like, how many times did you do them? Oh, no, they didn't do them today. Kind of calling them out. It's annoying. I get it, but it makes them push themselves, reminds them some of these rehabs are long and grueling. So it helps kind of keep them engaged as well. All right, so I'm going to kind of kick it off to the next speaker and back to Abby, but my contact information is here, and then I'll be sticking around for the panel as well. So thanks, guys.
Thanks so much, Caroline. So if any of you on the call happen to be in the St. Louis area, I think you guys, you have a gem in Caroline, and can tell just how much she cares for her patients. And I think that that's indicative of the profession of physical therapy as a whole. And I think you'll hear that as you hear from our next speaker, Morgan Ivy. Morgan is a residency and fellowship trained, board certified sports physical therapist at Champion Sports Medicine in Birmingham, Alabama. Dr. Ivy earned her Doctor of Physical Therapy degree from High Point University before completing a sports residency, during which she provided advanced rehabilitation and on-field care to high school and collegiate athletes in a wide variety of sports. She then completed a prestigious sports fellowship under the mentorship of Dr. Kevin Wilk, a global leader in sports rehabilitation. Beyond her clinical practice, Dr. Ivy is a published researcher and educator. She has co-authored several book chapters and peer-reviewed articles with research interests focusing on the female athlete, baseball and throwing athletes, ACL rehabilitation, and neurocognitive recovery strategies. Morgan, I'll hand it over to you.
Thanks, Abby, and thank you everyone for having me. I'm excited to be here, and I'm excited to talk to you all about some of the unique health considerations for female athletes, because I think it's a very often underlooked topic, and I think it would help a lot of people. All right, so let's get into it. So since we seem to continue to see more women excelling in sports at all different levels, from both the youth, professional, and even like the Olympic level, it's very important that we understand exactly how their bodies function differently from their male counterparts in order to customize their training. We can reduce injury risk and optimize their performance. So from a female athlete standpoint, just over the past few decades, we've seen a huge rise in female participation in sports. Women are, competing at high levels, like I mentioned before. But even though there has been such great progress, the reality is that most of the sports science currently and the training programs and even their injury prevention strategies have historically been based on the male athlete. So female athletes have very physiological, hormonal and biomechanical differences that are impacting their performance, their injury risk and recovery. And I think we really need to take these into consideration. So throughout the presentation, we'll discuss some of these key differences between male and female athletes. We'll discuss the role of hormones, common injuries, and critical health considerations like relative energy deficiency in sport and even pelvic health. So my goal is to help you all feel better about understanding how female-specific approach to training and rehab is going to be very essential for our female athletes to thrive. So just looking at a few gender-specific considerations when considering rehab for the female athlete, we want to first consider anatomical differences. So one of the most important is the Q angle or the quadriceps angle, which runs from the pelvis to the knee. Women tend to have more of a wider pelvis, which can lead to a greater valgus alignment at the knees, meaning that the knees tend to go more inward when they do different movements. So when you combine this valgus alignment with often hyperflexibility and even less developed thigh musculature, it can increase the stress on the ACL, which may be one reason for higher rates of ACL injuries in female athletes. Another key difference is the cubital angle, which is the angle at the elbow. It's often called the carrying angle. And women tend to have a greater angle, which can affect upper extremity biomechanics in overhead sports like volleyball, softball, or even tennis. Another consideration would be joint laxity. Oh, sorry, hold on. Alexa, turn off. Alexa, turn off. I'm so sorry, guys. We love technology these days, right? Alexa, oh my God, I'm so sorry, guys. Hold on. Alexa, turn off. Okay, so sorry, y'all. Okay, so when we think about laxity and instability, women tend to have a greater overall flexibility, which can lend to less neuromuscular control. This increased laxity can contribute to higher rate of injuries, particularly in overhead athletes like swimmers, gymnasts, or even volleyball players, softball, like I mentioned before. But to counteract this, we really want to think about injury prevention programs, and we want to think about neuromuscular training, proprioception, and strength training to really make sure that we're getting all of these factors. So since women exhibit different motor control patterns than men, a lot of times we need to make sure that we train their rehabilitation a little bit differently than we would train the male athletes. And this way we can improve their stability and control rather than just focusing on only strength. When we think about the game rules and some sport-specific factors, we want to consider that there's a variation in a lot of the competitive formats of the actual sport itself. So in many sports, for example, softball versus baseball, females pitch from a shorter distance and they use a larger ball, which will affect their throwing mechanics and their pitching demands. In volleyball, the net is lower in a women's game, which will influence their jump mechanics and even their block strategy. And even in sports like track and field, there is a little bit of a difference in the hurdle height and the race distance. So even though these differences might seem pretty small, it's really important that we consider these factors when designing a sport-specific rehab program in order to optimize their performance and, again, prevent injury. When we think about resources and training difference, historically, strength and conditioning programs, again, have been focused mostly on the standardized male rehabilitation program or the strength and conditioning program, rather than tailored to the unique demands of the female athlete. So if you were to sit down and actually read the research, you'd have a really hard time finding like position-specific or even sport-specific training programs for these athletes, which can, again, leave gaps in their training. Also, differences in coaching philosophies and a lack of injury prevention education will contribute to differences in performance outcomes and injury rates. So it's really important that we try to bridge this gap with more research, more targeted training strategies, and really just focusing on how we can educate them that their demands are going to be a little bit different than their male counterparts. When we look at training load and injury risk, we want to make sure that we do see a lot of clear trends, but we make sure that we look that women are more prone to overuse injuries, such as stress fractures. Sometimes they'll get more tendinopathies or tendon problems, and men are more likely to actually sustain more of a traumatic injury. And this is usually due to the nature of collision forces or contact sports that they're going to play. So another factor might be sport specialization. So female athletes who specialize before the age of around 15 tend to have a significantly higher risk of overuse injuries. So that's just another education point to make sure that they're aware of that. Lastly, hormonal effects. This is often overlooked, but we know that the female athlete will go through hormonal fluctuations throughout the menstrual cycle, and it will play a role in their injury risk. So the research is kind of mixed on this topic, but overarching theme is that during ovulation, which is when estrogen levels are the highest, ligamentous laxity will increase, which could potentially make athletes more susceptible to injuries like an ACL injury, tearing their ACL or tearing other ligaments or tendons in their body. So it's really important to understand this so that we can alter their training program during this time to make sure that they're a little bit more resilient. Another area that might be an ongoing area of research is the role of hormonal contraceptives. Again, it's very kind of tied. It's very different depending on who you read it from, but some of the studies are suggesting overall oral contraceptives may reduce ACL injury risk by stabilizing hormonal levels, which will make them kind of more similar to how a male bodies work, where they just kind of have that flat hormone level throughout the entire month, throughout the day. But their effects on performance, we really don't know. So I think it's a really good area that needs some more research on their long-term effects. Now that we've covered these differences, let's shift our focus to a more critical issue, which can affect many female athletes, which is called relative energy deficiency in sports, or REDS for short, because this is a very, unfortunately, very common syndrome that affects energy availability, metabolism, and overall health. And it's actually important to note that REDS is a new term for the female athlete triad. While the triad is mostly focused on energy deficiency, menstrual dysfunction, and bone health, REDS has actually incorporated more broader terms, including cardiovascular issues, immune suppression, and even some psychological symptoms like anxiety and depression. So this can actually impact both males and females, but we want to make sure that we're including all of these areas when we look at it. So a couple signs and symptoms would be persistent fatigue, poor recovery, frequent injuries, especially things like stress fractures. One red flag is maybe an athlete is training consistently and they're just not really seeing any progress because their low energy availability tends to lead to hormone suppression. So the body can't actually adapt to that training stimulus as well as maybe an athlete with enough fuel. Another major indicator is an irregular or absent menstrual cycle. So you want to make sure that you're always asking their athletes about this. Have you had a regular cycle this month? Has there been any changes? It's a really good screening tool to kind of cue you into something just might not be quite right with them. Estrogen and a hormone called IGF-1, they actually play a major role in protecting bone health. So when these hormones are suppressed or low, which happens with this condition, a lot of times the bone density might decrease, which can, again, put them at a higher risk of injury. Another physiological sign might be a high resting heart rate, and this would just be, maybe above around 60 beats per minute, and which would actually contribute to a higher than expected resting heart rate, an exercise heart rate. So you just want to make sure that if they're having any kind of changes there, you're monitoring them. And last, many athletes also experiencing maybe some bloating or some digestive irregularities, and this is just due to the changes in the gut brain axis that happens when they're dealing with these low hormone levels. So how can we prevent it? Well, first of all, education is going to be number one. We need to make sure these athletes understand that food is fuel, and restricting calories, whether it's intentional or not, can very negatively impact their performance and their long-term health, especially their bone health. And I think a simple screening tool is just really asking about menstrual cycle tracking, if they track their cycle or if they're regular, and then just kind of going from there and just making sure you're, asking the right questions. But like I mentioned before, it can happen to both male and female, so make sure you're screening for both. Your men, especially the lower weight classes or the categories where you have to have more of a weight control, that's going to be very important. So from a pelvic health standpoint, an often overlooked, again, critical aspect of performance is going to be pelvic health. So a lot of people assume that urinary incontinence is only a concern for older adults, but it's actually quite common. I'm so sorry, Henry, shush. It's actually a quite common syndrome that affects female athletes. So gymnasts, runners, and weightlifters will often experience leakage due to the repetitive high intra-abdominal pressure and the core instability that they may have. Beyond incontinence, pelvic floor dysfunction can also affect athletic performance, which might lead to poor core stability or compensatory movement patterns, and even an increased injury risk. So this is especially relevant for our athletes who may be postpartum, peri-pregnancy, or really just around childbirth years, because it can really affect their pelvic floor strength and their function. So despite the prevalence, screening for pelvic health concerns is not really a standard in most sports settings. So I think just, again, awareness is going to be where the biggest kind of bang for your buck will be. And then, if needed, we can always refer these athletes out to a proper assessment from a pelvic health specialist if necessary. So some of the common injuries in female athletes, overuse is going to be the most common by far. And this is mostly just due to, again, kind of that energy availability that I mentioned before, and along with biomechanics and their training load. So stress fractures are one of the most common concerns in endurance and high impact sports. And these are especially common with, again, the low energy availability athletes, or maybe athletes that have low bone density, or they're maybe just not recovering very well. We also see shoulder related changes. This is, again, one of the most common is the upper extremity. So sports like swimming, gymnastics, volleyball, these all place very high demands on the shoulder, and it's a lot of repetitive actions. So this can really lead to that instability and that overuse type injury. Female athletes with higher ligamentous laxity and that repetitive action are particularly successful for these types of injuries. We also will see things like patellofemoral pain syndrome, or, runner's knee is another term for it, but factors like a greater Q angle, really things that are sometimes out of their control, but also weak quads can also contribute to this syndrome. We see tendinopathies. This will be at the shoulder, at the knee. This can be really any repetitive sports. We'll see ACL tears, which I just mentioned, kind of the areas, and you might see that. And really with these athletes, you want to look at not just, why these things are happening, but what can we do to prevent it? So we want to make sure we're looking at their biomechanics whenever they're doing whatever their action is that's producing them pain. So if it's, pain up here, what does that look like? Is the posture okay? Is the core involved? There's a lot of different screening tools that we can do to make sure that we're really screening these out and figuring out what is the cause of this problem, not just, a volume or an overuse issue. I think that's most common, but we also just want to make sure we're not overlooking some of those other factors. So in conclusion, I think there's definitely some gender differences that will be very apparent that impact training, injury risk, and rehab. And I think it's important to just, first of all, be aware of these differences, and then learning kind of how to apply this to a clinical setting. So why does this matter? Well, whether you're a coach or a clinician, an athlete yourself, I think it's just important to understand that these differences can actually make a difference in your training program if you're aware of it and you kind of know where to start. So seeing a physical therapist or somebody who's educated in this, I think will be something that can take you a long way. So just by acknowledging and addressing the factors, I think we can actually provide better guidance and support for our female athletes and really help them to train smarter, stay healthier, and prevent future injuries. So, final takeaway, I think female athletes are not just smaller versions of males. I think training and medical kind of approaches to really be tailored to them, to their unique physiology and their biomechanics is going to be key. And then, that can take you a long way. So, and that is it. Thank you guys. And sorry for all the technology difficulties in background.
Thanks, Morgan. Did a great job. And not only, I think, did Morgan do an awesome job at distilling a lot of science down for us tonight, but also displaying the scope of knowledge that physical therapists possess. And, while, we aren't registered dietitians and we aren't, hormone replacement therapy specialists, physical therapists do have to synthesize knowledge that comes from all these different domains in order to take care of people. And in the world of athletics, that impacts healing. It also impacts performance, and it has a huge impact on a person's well-being in general. And I think the takeaway here is that we can influence all of those things by taking a really smart approach to how we look at athlete recovery. So our next speaker this evening is Nisha Diagidio. Nisha has been practicing for 5 years and currently works in our Select Sports Center of Excellence in Malvern, Pennsylvania. She specializes in treating the athletic knee, specifically ACL injuries and bone health injuries, including stress fracture management and osteoporosis osteopenia. In college, her passion for female-focused strength training empowered her to earn her CrossFit Level 1 certification and further start a female-only barbell program called Girl Strong. She has worked in a variety of athletic settings and with sports teams, including the training room at Penn State Brandywine. Nisha, I'll send it over to you.
Thank you so much, Abby, and thank you all for being here today. I'm so excited to be talking about preventing and recovering from sports injuries in women. So to really appreciate the different injuries that women have, let's look at their involvement in sport. We've seen a recent uptick in soccer, track and field, volleyball, and softball, specifically in the college setting over the last 2 years. From a rate of injury perspective, we see that female athletes are more likely to have ACL injuries. From a sport perspective, we see that women's soccer continues to be the leading rate of injury and specifically involves lower body injuries like ankles and knees. And then from an age perspective, we see that young adulthood, that high school to college age, is typically when they usually get injured. So the 3 main areas we're going to talk about today are the shoulder, ankle and foot, and the knee. Let's dig into the shoulder. So Morgan did a great job kind of covering these different injuries, and I'm going to dig into them a bit deeper. We will talk about more acute injuries that can happen spontaneously or more overuse and chronic injuries that can develop over time. From an acute standpoint, we can appreciate injuries that are more due to the hypermobile athlete, like a shoulder dislocation, subluxation, or instability. A dislocation is where your shoulder will actually come out of the shoulder joint. It can come out through the front or through the back, as you can see in the photo here, and it'll stay out in a dislocation. In a subluxation, it'll actually come back in. And if that happens over and over and often for an athlete, that's known as shoulder instability. We can also have rotator cuff strains where you tear the actual muscle. You can also have injuries to the actual cartilage inside of the shoulder, known as the labrum. And then from an overuse perspective, Morgan hit the nail on the head. Tendonitis or tendinopathy, all in the kind of same spectrum, is just a little bit more of an overuse injury due to inflammation at the attachment of the muscle to the bone. Again, just hitting those sports that are repetitive and overhead, we'll see swimming, tennis, softball, and volleyball be the more common areas in sports we see these injuries in. So what does rehab look like for the shoulder? In general, our goal is to calm things down and then build it up. We want to get the pain under control and we want to restore range of motion. I always tell my athletes it's like building a house. We want good bricks and cement before we interior design. which for me is all the strength training. We're going to try to progress strength into different planes and really build stability, and then eventually get them back to their functional tasks. For the upper body, it's like reaching, pushing, pulling, being able to put weight through your shoulder and carrying items. And then from a sport specific standpoint, we want to be able to throw, hit, block, anything they need to do for their sport. As Abby mentioned, one of my sites that I was at was a satellite campus for Penn State. And I was able to work with the female volleyball players. And during the season, preseason, I had one of the hitters have chronic shoulder instability. And she did have a bout where her shoulder popped out and came back in. So we were able to work together. And this is what her care looked like. We wanted to restore the range of motion first, but her superpower was her flexibility. So we didn't want to overstretch her or work too much on stretching because she was already a superstar at that. We really had to build some strength for her so that she felt stable to be able to block and hit. And so we worked first in lower planes before moving to higher. And then we really focused on the heavier strength and stability drills before adding in plyometrics, where her explosiveness to be able to block and hit, as well as catch and throw the ball. And once she was ready, we looked at her readiness for competition, doing a series of upper body tests that may be looking at her strength from one side through the other, looking for a symmetry of 95%, as well as doing different stability tests. It is, it takes a village to get an athlete back, as they mentioned. So I worked with the athletic trainer, coach, team physician on progressions and regressions to get her back on the court. So now let's move to the ankle. You'll more commonly see the lateral ankle sprain, where the ankle will actually roll in. And if this happens over and over, this is known as chronic ankle instability. It can be a gradient from 1 to 3, involving more ligaments that support bone to bone on the side of the ankle. And it can be involving also soft tissue structures. Very similar to the shoulder, we want to calm things down and then build it up. What's a little bit different here with the foot and ankle is that we're going to be playing with the floor or more functional tasks like squatting, balance, stairs. We're going to progress them to walking tasks, jumping, then running, change of direction, and sprinting. And ways to make it a little bit more sport specific are varying the terrain to an uneven surface, having a more chaotic environment that is more like their sport, where they have to react to different things. And I often like to use the offense versus defense mentality, because their ankle will respond very different if they're reacting to a force versus going and producing the force. Next, let's go to the bones. We already talked a lot about this, but let's dig into stress fractures and bone stress injuries, very common in female athletes. So stress reactions and fractures are on the same continuum. We typically see these areas, including the shin bone right here, be involved, the metatarsals, which are on the foot, and then you'll see in green here, the navicular bone be involved, as well as the hip and the pelvis. Common age is 15 to 24, and the most common factor is a history of a bone stress injury. The first line of defense is usually an X-ray, but sometimes these can be hard to find, and gold standard will be MRI if it's a little bit too small. One of my great mentors in the running and bone stress injury world has these awesome graphics to help us appreciate high risk versus low and moderate risk bone stress injuries, because no two are created the same. You can have a bone stress injury in one part of your foot that is going to be a little bit more conservative to heal and take a little bit more time just based on where it is. So we can appreciate here, like the navicular bone, or the front of your shin, or even the very top of your thigh bone be a more high risk spot. So it'll take a little bit more time for you to come back to your sport. Where low and moderate risk bone stress injuries can be still in the foot, but in different areas, as well as the middle of the thigh or the outside part of your lower leg. And we can just see here that there is quite a difference. Even though we're still in the foot, just a different bone and a bone stress injury can change the timeline of when a female athlete is coming back to sport. We see high impact activities like jumping, gymnastics, and long distance running be a higher risk. And specifically, the study did find that female athletes are more likely in these sports than men to have bone stress injuries. So what does rehab look like for a bone stress injury? Very common mindset, as we already talked about with the ankle and the shoulder. We want to calm things down, but what might be a little bit different here is the weight bearing tasks. So actually being able to put weight through your legs. With a bone stress injury, we actually might be minimizing how much weight you put on or completely reduce your ability to put weight to help that bone heal. You might be on crutches and you might be on with a boot. Again, we want to strengthen and maintain as much strength as possible, as well as cardiovascular health, while modifying and just respecting how we load the body. So you might be in the pool, or maybe my patients will be on the bike to be able to continue to get that stimuli. We want to progress structures and really use symptoms as the main driver. And then we want to collaborate with the medical team. We've really talked about REDS a lot here, but I think the biggest thing to take away is it takes multiple medical providers to help an athlete. And specifically with a bone stress injury, there's many factors involved as to why they're having physical problems. So we want to make sure we're working with the team to get the athlete back. And of course, getting them back to functional tasks and their sport. Now let's move to the knee, my favorite. 70% of my caseload is the athletic knee, so this is my favorite chapter for us to talk about. From an acute standpoint, we can see sprains at the ACL, MCL, and the meniscus, or tearing your meniscus. So you'll see the ACL is our anterior cruciate ligament, the MCL is the medial cruciate ligament, and the meniscus is the cartilage inside of the knee. That's our shock absorber, and it keeps everything moving nice and smooth. From an overuse standpoint, we can see runner's knee and jumper's knee, which is more agitation to the front of the knee. But let's dig deeper into the ACL. So the ACL is the main stabilizer in the knee, and it helps us with change of direction. Its job is to stabilize the bottom half of your leg so it doesn't move forward and in. Because of the mechanism of injury, we often see the meniscus and MCL involved. Often, athletes will complain of a popping sound, feeling like they're losing range of motion, swelling in the knee, unable to walk, and a very difficult time just moving around. There can be different grades from 1 to 3, 3 being the most intense, 1 being more minor. And causes typically are twisting, cutting, braking or decelerating, landing from a jump, stepping awkwardly, and it can also happen contact. 80% of these injuries are non-contact, and it can happen within milliseconds. So let's tie this together with the female athlete. 2 to 8 more times women are likely to have an ACL injury. Research is looking at many different factors that we've discussed, but again, to just kind of hit that home, hormone changes, anatomy, landing mechanics, and strengths are really where the research is looking at this. Interesting enough, I think to really appreciate, as Caroline was talking about, women being active through the lifespan, this one study did find a second peak in their 40s. So I do think we need to appreciate that women, not only in their youthhood, but if they continue to stay active, could be susceptible for an ACL injury later than we think as well. There's factors that you can change and there's factors that you can't change. Unfortunately, you cannot change your age, but there are things like your readiness to play, your environment, and your strength are modifiable risk factors. From a surgery standpoint, we can repair your ACL or we can do a full reconstruction. I often tell my high school athletes, I'm like, you have a more expensive knee than me. You have a Louis Vuitton knee. That is an expensive knee, sister. Different areas we can use are the quad tendon, the front of your thigh, the patella tendon, the bottom part of your kneecap, your hamstring graft, which is in the back of your leg, or someone else's ACL, which is cadaver. Conservative management looks like bracing and physical therapy. And if you do go down the surgery route, it can take 9 to 12 months, even more, to get back to sport. These are important but hard statistics to swallow. ACL athletes are 7 times more likely to re-tear if returning to sport prior to 9 months. One study found that if you have more symmetrical quad strength, and you wait at least 9 months, you can actually reduce your rate of a knee injury by 84%. And for every month you wait 9 months and after, you can reduce your rate by 51%. So there's power in waiting and there's power in building strength. Things that can increase your re-tear rate if you've had an ACL tear before, if you're young, if you're going back to a high level of cutting and high impact sport, and if you just don't feel ready. And currently, we find that 55% of ACLers return to their prior level and 1.7 times more men return than women. So we got to do right by our female athletes. We got to get that statistic higher for women. So let's talk about my patient. She was a sophomore in high school who tore her ACL in the start of her season. It was only her ACL. She didn't have any meniscus or MCL involvement, and this was her first major injury. And she ended up having a quadriceps reconstruction. One of my great mentors kind of gave me different chapters of ACL care, and I think it can really help because 9 to 12 months is a long time for you as a clinician, for the patient, and I think being able to bundle it into different chapters and really focus on the main goal and the main thing can help instead of focusing on something that feels so far away. So having short, achievable goals. So we're going to dig into each of these chapters, the restore, rebuild, return, and resilient phase, and I'll show you what that looks like with rehab. So 0 to 3 is really keeping the knee happy. She just had surgery. She's very grumpy. We want to get that swelling down. We want to get that quad activating again. And we want to get my patient to be able to do functional things when they can drive, when they can walk, when they can move around school. So it's really just building that base. Many athletes will remember the first time they lift their leg up and squeeze their quad, it feels like 100 pounds. Nervous to have somebody kind of move their leg, but help them with range of motion. We might be using a machine to help wake up the quad because it often will fall asleep after having surgery and it needs to learn how to wake up again. We'll be doing range of motion exercises. I know every patient who's had a lower body injury remembers the first time going around the bike when you make it all the way. The whole clinic claps. It's just an exciting thing. And then being able to really focus on single leg strength. You'll see something over here. This is actually called blood flow restriction training. I like to call it altitude training for my patients for their thigh muscles because it's a way that we can occlude blood flow to the area and make a task that's body weight or lightweight due to their post-op nature feel really, really hard. So it's a great way for us to get them nice and strong when they can't really put a lot of weight on their leg at this time. So that's a restore phase. Then we're going into a rebuild phase. I like to think of this as my middle school phase. It's getting your leg back to different positions you haven't been before, and it's really heavy on strength. So we're definitely focused on using machines and open chain, being able to load that quad in an isolated manner, as well as a functional manner like lunges, deadlifts, you name it. Once the strength is around 75% of the other side, we're looking to add in jumping. And once we've gone through a jumping protocol, adding in a running program. After 6 months, we're looking to the return stage, trying to get back to a sport-like environment. And so we're inviting a little bit of chaos in the clinic, focused on positions of acceleration and deceleration, whether that's from a conditioning standpoint or a strength standpoint. Having her go through a sprinting program. She was doing change of direction and easing into different angles that get more and more intense as you cut back. Working on fatigue-based training and landing mechanics, and of course, getting a soccer ball on her feet, and even playing with these blaze pods that can stimulate a very active and more like a sport-like environment for her. And then at 9 to 12 months, she passed all her return to sport testing. So we're fortunate enough to have force plates at my clinic, as well as access to a machine called the Biodex, which is the gold standard machine to measure your hamstring strength, quad strength, and how fast and how explosive you can be to get into those different strength measures. She was able to meet over 90% limb symmetry. So she was almost 100% equal side to side. And then from a jumping perspective, her vertical, we looked at her landing and actually having data points to see, okay, can you jump equal on your right versus your left leg? How explosive and how quick are you to get into those speeds? She was able to go back to a strength and conditioning setting, and she had 3 months to focus on return to sport. We were lucky based on her time frame of when she got hurt. And from there, she was able to play her final season. She was recruited to play soccer and actually wants to be a physical therapist. So that was a pretty good Cinderella story there. And just to wrap things up, talking about injury prevention and risk reduction. From an ACL perspective, it has been shown that ACL injury prevention programs can reduce the risk of ACL injuries up to 70%. From a prehab perspective, if you do go down the surgery route, you can do 4 to 6 weeks, and it has been shown to improve your short-term outcomes of strength, motion, and the odds of returning to sport. From an overuse perspective, we want to manage activity loads appropriately, have good rest breaks in there, a variety of stimuli in your exercises, and obviously working with a health professional when needed. And then with bone stress injuries, very similar to the overuse injury management, but definitely an emphasis on appropriate programming, strength training, and working with the dietitian. And that's it. Thank you so much.
Awesome, Nisha. Thank you very much. And I thought you did a great job of highlighting the journey that really happens for our athletes with some of these more serious injuries, and the way that we use, as much as we can, data to make good decisions to send our athletes back to sport with a semblance of success in mind, and not to just cross our fingers and hope for the best. Physical therapy is a lot of times an art and a science, but making those big decisions to let someone go back to a sport like soccer or volleyball really requires a lot of that science piece as well, to help give athletes confidence, and also to help try to change those statistics for the better for our female athletes. So thanks for highlighting all that. We're going to move on to our next speaker tonight, Lou Fullenkamp. And Lou's been waiting patiently for his turn to address everyone. Lou Fullenkamp is a physical therapist, strength coach, and educator specializing in sports performance, rehab programming, and dry needling techniques. He is the manager of the Centerville, Ohio office and an adjunct faculty member at the University of Dayton Doctor of Physical Therapy program. Lou is also the creator of the Lab Collective podcast, where he explores the intersection of strength and conditioning, rehabilitation, and athletic performance. He applies a systematic approach to movement assessment, strength development, and recovery strategies to help athletes and patients perform at their best. It's all yours, Lou.
Thanks, Abby. No, before I get started, I just want to say this has been an absolute treat to be able to sit in here and just listen to the earlier speakers, and just see the wealth of information that is around the country amongst our company. And it just kind of makes my heart happy to see, the good hands that the patients and the people around us are going to be able to benefit from that wealth of knowledge. Before I also kind of get into the weeds of my information, I just wanted to take a minute to say, thank you to my mom and my sister, who have just been phenomenal examples in my life. That's them right there on the picture. My mom and my sister have led by example 100-fold, both competitively and just moral fiber in my development as a human being. But when I got my first topic, when it was just building strong athletes across all ages, they immediately kind of stuck out in my mind, because my sister has been nothing but an absolute gem in terms of athletic development, taking the right steps, and she kind of almost led the breadcrumbs for me as an athlete. And that's why I wanted to kind of share some of my passions and some of the information that I want to share with you all tonight. In particular, so like age and training do kind of go hand in hand, and they're not just for the athletes, they're for everybody. And that's what's wonderful about it, is that exercise can be a wonderful asset to your daily life. And that's why, as you can kind of see here by the first slide, age-specific training tips, right? We're going to look into youth, we're going to look into collegiate athlete, we're going to look at adult athletes, because it is about maintaining your quality of life throughout the ages and throughout the days. Even with an injury, you can still pick up the pieces and move forward. This is going to be fantastic, guys. I already loved. I mean, Nisha, you did a fantastic job. I was like drooling over all the information you had out there, so it was awesome. But to kind of start here with the youth athletes and the younger athletes, as you guys can kind of see, we want to start taking our due diligence, both as practitioners and as family members, and we want to provide a strong foundation for the youth to basically start making advancements in their later days. So with the younger athletes, we want to make sure that we're constantly addressing, their movement patterns, especially through growth spurts, being able to take a step back when we do have maybe a little bit of pain, and kind of like, maybe you don't need to suck it up. Maybe we do need to go get this looked into. I think it's really important to start talking about, at a younger age, being able to get kids into a diverse amount of different sports. I know sometimes kids can kind of get pigeonholed, like, oh, they're really good at basketball, let's put them into basketball, and we're going to go, year round on that. And sometimes it can be hard, because once you join a club team, you're locked in. We're talking dollars, we're talking trips around the country. Sometimes we're going to showcases, because kids, recruiting process can start very early on, which we know can be both a trial and tribulation, especially for a child as young as 14 to 18, when they're beginning to develop. And there's a few different social aspects that go along with that as well, in terms of like social structure, developing friendships, and when you don't have friends that don't do those sports, and you're not going to want to hang out or do those other things. And that's why I think, as family members and having that social structure, it's beneficial to start talking about those things now at an early age, because then it can lead to benefits down the line, especially when we get into some of the later age groups. We don't really want to diminish the positivity of play. And when we get so locked in and we become so specialized and we learn those and we develop and hone in on perfecting those types of movement patterns, um, I think we lose the chance for developing other types of patterns, structures, maybe building resilience in other areas, like Nisha was kind of going through the different areas of the body. And that's why I think as we kind of work through those with our kids, and if they do have an injury, we want to make sure that we're pushing back, not just to like where they were before, but getting back to beyond what they were, because how they were got them to us. Another thing to kind of talk about would be strength training. And I think sometimes people, when they hear strength training, um, they're really afraid to put children or younger athletes into, like, strength and conditioning type programs because they're either afraid it's going to stunt their growth, or they're not going to develop as efficiently, or they're at a high risk for injury. And that's simply not the case, because unless you're going to be putting them into a situation for failure right off the get-go by either overloading them and not doing a needs assessment, not finding what is the entry point for them, that's not beneficial to them as a developing child, let alone as an athlete. And that's why I think that becomes a good point of like finding a strength and conditioning coach, finding an athletic trainer, finding a physical therapist that can lead you in the right direction, point you. If you have questions, feel free to reach out, kind of a thing. Especially even if it's not an injury, maybe you just want to have the right direction. You yourself want to get back into training, and maybe you've had an injury and don't know where to go. Physical therapist clinic can be the great place to start. So in terms of going on into the next section here, what we're going to talk about is more along the college athletes. So in my practice, I kind of get a good mix of the high school and college kids with a few professionals kind of mixed in there. And I've actually found that my college kids will ask significantly more questions because they want to know X, Y, and Z about possibly getting back to play, right? And I love the inquisitive nature that they have. And I think that as we kind of start moving from like admittance to moving through their programs, it's really important to start talking about different things besides just the physical. So like we already talked about, like the social structure, but going along other aspects of like, what maybe is your sleep like? What is your nutrition like? And those things don't always come up in physical therapy assessments, but I do think that is like, I've been continuously practicing, and I'm sure around the country we have that as well. People are taking in the whole athlete, not just like the physical therapy aspects of that. And I think sometimes when people hear strength training, they think if they touch a weight, they're going to really like bulk up, put on another 50 to 100 pounds, and they're going to look like, Arnold Schwarzenegger. And that's just simply not the case either. Strength goes a long way in the world. And if you have strength, the longevity of your life can also be improved, let alone the quality of your life can be improved. Another aspect of, we always want to talk about what can be the next weight, what can be the next progression, and what can be the next, movement pattern or, blaze pod activity we can add in. But I think we need to talk more about recovery in all aspects, where sometimes, it's not always about the cold plunge. It's not always about the sauna. Sometimes it is about dialing in the sleep and nutrition, and not to mention being able to like not being in a guessing game. If you've never exercised a day in your life and you don't know which direction to kind of take, we want to be able to put in a plan for someone. We want to give it direction. We want to be able to take the different attributes that maybe you are lacking and actually provide a stimulus to that area so we can move forward. So computer just closed on me. There we go. So another aspect that we can kind of talk about, especially when the kiddos start kind of going away to college, is just the mental and well-being stress that kind of comes along with that. When people are going from a place of familiar comfort, when they're at home, they're in high school, it's easy to have that social structure of mom and dad. And then when they go out to college and now they're kind of, low person on the totem pole, and they don't have a whole lot of friends maybe initially, and they're that developing athlete, or maybe they just want to work out at the gym's recplex, that can be daunting. Sometimes some of those instilled values of exercise kind of deter a little bit, but as we can instill that social structure around at school and getting into that more and more, I think that can be a benefit. Sometimes bringing a friend to the gym can be a wonderful thing as well. I think having a partner, someone who can watch you and kind of teach you, and it's always a wonderful thing. And there's always someone at a gym that's always willing to teach and learn. And sometimes they'll have personal trainers or strength coaches at areas of the schools that you can also ask maybe for more insight as well. I know a lot of the information that I have here on my next slide with the adult athletes, we've already touched on a lot of. One thing I do want to kind of go more into depth on, though, would be more on like the bone density. So like once we hit a particular age, we're going to start losing muscle mass. And that's a natural process depending on like what's your nutrition intake like, and then how much are you actually providing a stimulus to the muscles. And one of the things like that goes along with that is that you don't have strong muscles to pull on the bones. Well, then we can improve on bone density. And nutrition is a whole side of that, and that is great and wonderful. And we need to definitely take those into consideration. But what comes along with resistance training comes with stressing to the bones, and with the stressing of the bones, we can start building bone density. And that is a huge thing later in life, especially when we start reaching into our higher age years, where, you know, if you do have the fall and you fracture a bone, well, maybe if we had a little bit of resistance training our side earlier, or maybe we set the foundations at a much younger age, maybe we don't have as many or frequent amount of fractures toward our later years. The other thing to take consideration, I talked about before about having some direction. And when you have your younger athletes and your younger kids, it'll be easier to tolerate more exercise volume and the intensity. But then when we start getting into the later years, you know, when we have a work schedule, we've got multiple kids to kind of juggle, maybe a few dogs and cats, you never know. Looking into what's like my time to train, how much time do I have to exercise on a daily basis, let alone a weekly basis, and then how much time can I dedicate towards exercise. And sometimes people think if I can't get it in, well, I shouldn't just do it. I won't do it at all. And that's where I think sometimes having a training partner or having someone to exercise with can be beneficial because it keeps you accountable. Accountability can be a wonderful thing when shared between people. And it just creates a stronger friendship and allows you to push towards your goals, maybe even compete, basically selecting a competition to do together. So my question is, if you're going to be engaging in some form of exercise or you're going to be engaging in some form of competition, what is your why? And that, I think, gives you a purpose, and the purpose makes the exercise much more worthwhile. And that is huge. I mean, I was just talking about my sister. My sister was actually an Ohio State cheerleader, and my mom had never really been big into exercise. And one of the wonderful things about it is that the more she saw my sister consistently pushing herself, my mom actually got into the Disney races. My mom started doing the 5Ks, the 10Ks, and my mom became a really big walker, and I absolutely love her for that. That's something that I hope to take into my later years as well, especially with the fact that I love training right now, and I hope I continue to love it till my later years. So if you ever have any questions, I mean, we have a wealth of information, as you've already seen throughout the majority of the previous slides and presenters, and I think you'll be in good hands. But just a few little takeaways to kind of wrap up is that, you know, anyone at any stage of life can benefit from exercise. It's just finding a good entry point and being able to have a good pair of eyes or a good direction to kind of lead you to that success. The other thing is that strength and movement quality, well, I mean, you've heard this multiple times over this webinar tonight, is resilience. Resilience is big. And strength training, movement quality go hand in hand, and that does create resilience and reduces the risk of injury. Third, going on here is that you want to start, like we were talking about, there's things we can't modify, right? So kind of repeat this part is that physical age, hormonal changes, those all need to be taken into account, especially when creation of an exercise program for that individual with a needs assessment. And then finally, last but not least, if you want to have long-term fitness, health, performance, what have you, what is your why? And I think if you can establish that, you'll go a long way with your training and with your exercises. But that's all I really had for you all tonight. I wanted to thank Abby again for including me in this. I had an absolute wonderful time listening to everyone here, and I hope you all have a good night.